Assalamu alaikum, the clinical day. First scenario, Mr. John Adam, 25 years old, male, presented with jaundice, lasting for the past 6 days, accompanied by elevated ALT levels. Please take history, examine and address his concerns.
Okay, hello. Hello,
Hello.
my name is Dr. Ahmed, one of the medical doctors. Could I confirm that I speak with Mr. John, 25 years old?
Yes, doctor.
Okay, nice to meet you.
Nice to meet you, doctor.
Today I am going to take history. I will examine you and I will address your concern. Is that okay with you?
Yes, doctor.
It came to my knowledge that you are complaining of yellowish discoloration of your eye.
Yeah.
Okay, can you tell me more about this?
Yes, doctor. I observed that my eyes color is changing over the past 6 days. In first, I didn't notice that, but my friends and also my family at home, they saw that my eyes is getting more yellowish in color, and that's why I came here.
Okay, this is the first time to occur or it has occurred before?
No, this is the first time.
First time. It occurred suddenly?
Yes, I noticed over this period of time.
Okay. You think there is something increasing it?
No, I didn't observe, in fact.
Okay. This yellowish discoloration, it is present all the day or at sometimes it come and go?
No, it's always there.
Okay. Yes. I wanted to ask also regarding that one, any associated pain in any site in your body?
Yes, I have tummy pain.
Tummy pain. Since when started that pain?
Yes, similar time, and you can say like it's aching pain and discomfort more than a real pain.
Okay. Where is the site of this pain exactly in your tummy?
Mainly in the upper side of my tummy.
The upper side of your tummy. Okay. You think there is something increasing or decreasing?
I didn't observe.
Okay. The severity of this pain from 1 to 10, can you give me a number?
You can say around 3 or something. It's just aching. It's discomfort. I feel like discomfort. You understand?
Okay. This pain, it is only in your tummy or it is referred to any other parts in your body?
Just in my tummy.
Just in your tummy.
Mm-hmm.
Okay. This pain, it is continuous or it is present at some times of the day?
It's like discomfort maybe most of the day, but
Most
it's
of the
not
day.
prevent me from sleep. I can sleep with the pain.
You cannot sleep with this pain.
I can.
You can sleep. Okay.
Yeah. Mm-hmm.
Also, I wanted to ask regarding this pain. It is progressively increasing in its severity or same as
No,
from the 6 days?
similar.
Similar. Okay. You took any medication to relieve this pain?
No, it's not. That pain needs some medications. It's just like I'm not happy about it, but no medication.
Okay. You feel sick or there is any thrown up?
No.
Okay. You have any weight changes?
No.
Either decrease or increase? No. Okay. You have fever?
No.
Any sweating?
No.
Any bumps or lumps?
No.
Okay. Any change in your bowel motions?
No.
Okay. Any change of the color of your stool?
No.
Okay. Any weather preference?
No.
Okay. Any muscle weakness?
Not weakness, but I feel like I have no energy all the day.
No energy. You feel fatigue.
Yep.
Okay. There is no energy or fatigue when this started. Also 6 days or before?
Before that, this goes for the past 1 month. I feel like extremely fatigued.
Okay. So this fatigue is not associated also with any pain or any other symptoms?
Not pain, but extremely tired.
Extremely tired.
Mm.
What else I want to ask? Yes. Any lumps or bumps?
No.
Okay. No joint pain?
No.
Okay. I wanted to ask regarding your past medical, any past medical history I should be aware of?
No, I quite well. I'm just 24.
Nothing in the past. You don't have.
No.
Okay. Any other disease? Okay. Any past surgery?
No.
No history of blood transfusion?
No.
Okay. Regarding your medical history, can you show me your medication list?
I'm not taking any regular medications.
Any over-the-counter medication?
No.
Any herbal medication?
No.
Sorry to ask, any recreational drugs?
No.
Okay. Any recent travel history?
No.
Okay. Regarding also, I wanted to ask, sorry, regarding your periods, it is regular?
No, male.
Yes, sorry. Sorry. Okay. Social, what you are doing for work?
I'm working in an office work.
In office. Are you married?
No.
Okay. You don't marry. Sorry, you have any intimate relationships?
Yeah, but I use barriers and
Okay. Any contact with HIV known persons?
no, I don't. I didn't think.
Okay. You underwent before HIV test?
No.
I recommend also that just to refer you to a scientist to do this test if you have this intimate relationship. If this is okay with you.
I use protection. Safe sex.
Okay. Do you smoke?
I do.
How many cigarettes per day?
Around 4 to 5 cigarettes a day.
Over how many times you are receiving it?
Since I was 18.
Okay, so now about 7 years. Okay.
Yep. Mm.
Okay. Do you drink alcohol?
I think my drink is social.
Okay. And also over the weekend is also this is social?
Yes. I only drink over the weekend.
Okay. I wanted to ask you regarding any you have any visual disturbances?
Visual disturbance, no.
Okay. You have headache?
No.
Any history of fits?
Yes. It's not like a fit, it's like tremors.
Okay. When this started?
Also, over the past 1 month, when I feel like I'm quite tired, I feel my hand shaking.
Okay. Both your hands?
Yep.
Okay. You notice anything increase this is shaking?
Not specifically, but it's more obvious while I'm moving my hands.
Okay. So when you are moving your hand, this is shaking is occurring.
Yeah, it's more apparent.
Apparent. On the rest, there is no this
Yeah,
shaking.
it's it sounds like disappear.
Okay. Any history of blackout?
No.
This history of fits or shaking you are telling on your hands. There is no. It is noticed by any close person.
Yeah, my mom also observed that I'm shaking while they want to give me something like cabo or something. I have this shake. It sounds like apparent to
Okay.
people as well.
Okay. When you take food or something, is this shaking is relief?
To be honest, sometimes I miss my mouth.
What do you mean by this?
Like sometimes I have this shake and I feel like I can't concentrate to put the food in my mouth. This happened maybe twice and it was strange.
Okay. So you are not feeling the thing is in your mouth, you mean?
No, I have this shake while my hands is shaking. I miss my mouth. I can't put the food in my mouth because of the shake.
Okay. This is the first time that one occurred since 1 month, not previously.
Yeah,
Okay.
yeah, just over this 1 month, everything changed in my life.
Okay. Can I examine you?
Yeah.
Okay. I will go for the general examination. Give me the vital signs and the body mass index. It is normal.
Normally, yeah.
Okay. Generally, the pulse.
Yeah, but pulse is normal. 90.
Okay.
90.
The hand, any palmar erythema, clubbing. General.
No palmar erythema, no clubbing.
No clubbing. This is checking in the hand. I wanted to examine the hand look and feel and also the movement.
Mm-hmm.
Any abnormality?
Yeah, you feel the hand is shaking, but what abnormality are you looking for? There is
No,
shaking.
this is shaking is bell rolling is shaking or was what is
Yeah, yeah,
it is bell rolling it's shaking. Okay.
yeah.
Okay. Okay. When I ask you, there is any speech abnormality? When I asked you your name,
Yes,
there's
yes,
speech. Yes,
yeah.
there's speech. Okay.
Cleared speech.
I wanted to make for you the test for finger to finger test and
Yeah.
the rebound positive.
Yes.
2 minutes left.
Okay. Okay. What is your concern?
What's going wrong with me, doctor?
Okay. From the history and also the examination that I will complete, mostly you have a disease named as Parkinson. Okay, is this disease will be affection of your nerves, the cables on your body, and we will make a multidisciplinary team, including the nerve doctor, and we will start for you the medication accordingly. And also we will make another meeting with you to endorse you regarding other further management. I will go to also to complete the investigation. I will make the motor.
Mm-hmm. Doctor, you are saying that I have
Hello?
Parkinson,
Motor normal?
Parkinson disease. My grandpa has Parkinson. I'm just 24. What's going on?
I appreciate your concern, but we will still make our tests and investigations, and we will see what is the cause of this.
Okay.
Yeah, you have not received any over-the-counter medication or any. You don't. Yes. So you have this disease run in your family. Yeah. You have this condition also in your father before.
My grandpa, yeah.
Okay. So we'll endorse you regarding. Also. I wanted to make abdominal examination.
Okay. What you look for the
liver, spleen.
Large in the liver. There is liver or large. Spleen normal.
Large. No ascites.
No ascites.
Okay, so we will add in the concern also, and will involve also the gut doctor to see what is going with you, because also maybe you have some diseases familial. So we will reach the final diagnosis. We will tell you by the nerve doctor and also the gut doctor.
Okay.
How does that sound with you?
It's okay, doctor.
Okay, time is up. One more extra minute added. You want to ask anything else, Dr. Ahmed?
Yes, the lower limb examination also.
Okay, do it quickly, then we will start the exam question.
There is no weakness. Other thing.
No weakness. Lower limb edema.
No weakness in the lower limb.
Okay.
Okay. Now we start the examiner question.
Okay.
Okay. So present your case.
This young gentleman, he has a history of jaundice and also abdominal pain. And also from the taking history, he has also checking of his hand. On examination, there is bell rolling, and there is also affection of his movement, and also there is I make for him the cerebellar examination. Also, I wanted to examine the gait. I forget. It looks that he has cerebellar affection.
Okay. So how? Okay. What you will do for this patient? What your diagnosis?
Yes, we will do investigation for him. We will do ultrasound abdomen. We will measure also for him the routine labs, CBC, RFT, LFT, calcium, sodium, and potassium. Also he has a history of his father. So make the serum ceruloplasmin. Also, we will make for him imaging for his abdomen, ultrasound abdomen, and we will do for him MRI brain, and the multidisciplinary team to see to reach to the diagnosis.
Okay. What one bedside investigation you want to do for this patient, if you have a time?
Bedside investigation?
Examination.
Examination. Bedside examination. I will do the gate. I forget to do.
Okay. So how you think it's going?
It is for differential diagnosis. Maybe this Parkinson or some drugs may cause this medications or cause this Parkinson.
Any history of medication in this gentleman?
He told no history.
Okay. What other possibilities?
Maybe also because his father has, maybe it is Wilson makes this Parkinson symptoms.
Okay.
Also because he has also hepatomegaly. Also we should ask for the hepatitis markers and also we'll check maybe he has also bilharziasis in the liver. Maybe he has double diseases, not only one disease also.
Okay, why you think about bilharziasis?
Because he has hepatomegaly and splenomegaly.
He has no splenomegaly, he has hepatomegaly.
Yes.
Okay. And if we are thinking about Wilson, what lab investigation you will do for this patient to confirm the diagnosis?
Yes, serum ceruloplasmin.
Okay.
It will be decreased, and also we'll measure the copper in the urine.
Urine, okay.
For Wilson also, because there is also hepatic affection and neurological affection. It can be Wilson.
Okay. And you mentioned before that genetic testing as well, yeah?
Yes.
Okay. You said that he has because he has family history, maybe. Okay.
Yes.
No more question. Thank you. 5 minutes finished, yeah?
It's still 40 seconds. So I will add some questions.
Okay.
You mentioned image to do, Dr. Ahmed. What image you do here?
Imaging for him, we will do the ultrasound abdomen. Important to see the liver.
Okay.
And also because this is shaking in his hands, we should do MRI brain.
What other image specific for the liver? What we call it?
Fibroscan.
Yes. Okay, to rule out cirrhosis.
Fibroscan. Yes, cirrhosis. Yes.
Okay. If you suspect liver cancer or hepatocellular carcinoma, is it possible with Wilson? You think?
Wilson progress to liver cancer. Cirrhosis. If there is cirrhosis, it can progress to liver cancer.
Okay, but it's by itself it doesn't cause.
Yes.
Okay, you mentioned bilharziasis. What do you think the risk factor of bilharziasis?
First, the country or where you are, where is the housing or on this swimming on this freshwater canals. Okay. And also, this is the most important.
Perfect. So, do you have any of these travel history or endemic area?
No.
So,
There's no.
yeah, don't put it in the differential at all.
Oh.
It will minus the differential.
So this is the cause.
Let's correct the differential. What other differential you can put here?
Because there is no drug history, maybe if there is the extrapyramidal manifestation of methylbromide, but
no, for the liver disease, what you could put here as a differential?
Also hepatitis,
for chronic
maybe.
Liver. What type of hepatitis?
Hepatitis C virus.
Infectious, you mean?
Yes.
What else? Does he drink alcohol?
Yes, he's drinking. Yes, alcoholic liver disease.
So yeah, perfect. Okay, I think this is enough for the question. Now the comment from Dr. Mayada, please.
Okay. So this patient, I think you start well. You explore what is the first. You explore the jaundice. When the jaundice starts and it sounds like a acute one. There is a. We can say in the scenario they said that the ALT is more raised, so we are thinking about hepatocellular type of jaundice, and in this age group with this no risk factor, he has. I think we need to explore more about the risk factor of hepatitis, which is, I think you did well that you ask about the relationship and sharing needles, I think. And also you ask about the medication, and this has been done. The only thing that when we you on examination, I think you need to the one examination that you need to do is the slit lamp examination for the Fisher. I forget the name of what is the name, Cullen Fisher or what? The name is
You mean Fisher ring in the
Kessler
eye?
Fisher rings. Yeah.
Yes.
So this is the simple
Kaiser
examination. The simple
Kaiser Fisher.
examination
Kaiser
for
Fisher, yes, Kaiser Fisher.
Kaiser
Sorry, yeah.
Fisher's ring. Okay, so you need to, it's like brown-green ring around the cornea. So if you didn't have a lump, you just ask for it also, because it's can be the differential. In this patient also, you need to ask about psychological manifestation like depression, and because they most probably they will come with manifestation of neurological manifestation and psychological manifestation as well before appearing of the hepatic things. Okay, and also it's you are right that he has Parkinson. Because the Wilson disease will come with Parkinson features. Okay, you are right that he has Parkinson, but we need to investigate that. The important thing that you need in the investigation to rule out there is no hepatic failure, because these patients are prone to have acute hepatic failure. So I need from you to mention that you need to look for the synthetic synthetic part of the liver function, that's the coagulation profile, including INR and BT albumin, to look for hepatic failure, because these patients need urgent urgent referral to hepatologist. That's why you need to include them in your MDT, the referral to a specialist hepatologist, and for neurologists as well, and they need also multidisciplinary, including the psychological doctors as well. And you need to find out how this disease affect his work, because they are having problems with concentrations, and many psychiatric things can affect their jobs. And you need to find out, because they need help and occupational support.
Yes. Yes, I forget this. Yes, important. Yeah.
In these patients. This is the main things, I think, in this part. And I think also from the differential diagnosis for this patient, apart from hepatitis, also you need to exclude the autoimmune disease. You need to ask about other autoimmune disease. It's good that you are looking for, in this case, I didn't think that you find any sign of chronic liver disease, like clotting and these things, because the history sounds like acute. But you need to find out the signs of hepatic failure. That include ascites, as you did, and jaundice, and you need to make sure that this patient is not having acute hepatic failure, because they are prone for that, and this is very dangerous. Yeah, this is, I think, as far as in this history of this patient.
Yeah, perfect, Dr.
Okay.
Mayada. Yes. Thank you, Dr. Mayada. Welcome, Dr. Ahmed. I think I will not add
Thank
for
you
the
very
topic
much.
from Dr. Mayada already explained well. But again, for the approach, you have to roll out a lot of things in this scenario. The common is common, the alcohol on the top. Then the other cause of chronic liver disease, particularly in young patients, you have to rule out the infectious cause, hepatitis or HIV, and autoimmune, as Dr. Mayada mentioned. Plus our case here, Wilson because of the family history. And the last is
Yes.
acute toxicity, but it would be with drug like paracetamol. I think it's not in
Okay.
this case, but still, as acute presentation since 6 days, so we can think about paracetamol overdose or toxicity, particularly if the patient is having any suicidal or any thoughts, suicidal thoughts. So we have to suspect it and to ask about any over-counter medication. It's very important question here. Plus the HIV, of course, you have to
Okay.
rule out other infectious cause, as I mentioned. As analysis of the complaint, you did well. The relevant system here is GI, right? You can add to them
Yes.
constitutional symptoms. Why? Because jaundice, one of the alarming signs and symptoms that it might happen with severe infectious or infectious disease. So you have to ask about
Yes.
the relevant system, which is GI, starting from the mouth, the difficulty of swallowing, mouth sores, any blood coming from your mouth or from back passage, any tummy discomfort as you discovered, or tummy pain, feeling sick, or throwing up, change of the bowel habits. All these questions will be related to the relevant system. Then you can ask about the constitutional symptoms, which are, as you know, the lumps or bumps or decrease, a change in the weight or a change of the appetite, plus the fever and night sweats. By this way, you roll at least either to roll out the infectious cause or to roll it in. So you can have HIV or hepatitis if you have, for example, loss of weight or loss of appetite, feeling sick. You can know and you can conclude that you have HIV, hepatitis or HIV as a common cause. Since this patient is young, so you might have the family history positive, which will be in the social history. But before the social history, you will do the systemic review to find out any CNS manifestation. You will start from the head, of course, CNS, any change, any headache, any change of vision, or any weakness, any speech problem, any memory, any change of your mood. All this question will be conclusive to CNS manifestation if it is there. Pins and needles you can add also as well. Then the endocrine, then the cardiovascular chest. I think most of them will be negative. And next will be the genitourinary, the urinary system. Then the last is musculoskeletal and joint pain. You might have change of the skin. What do you think? If you will ask about skin change or skin rash, what do you think you might have here as positive?
It will be discoloration because of this copper deposition.
Or the jaundice itself.
Yes.
So you might have even jaundice, yellowish discussion of the skin. Okay,
Yes.
then the social family travel here is very important. You can suspect hepatitis A only with travel. So
Yes.
if you have family travel history with the change of the food type or the food nature, eating from the streets, restaurants, or street, you can suspect hepatitis A, particularly if someone having the same disease in the group.
Yes.
Yeah, after that, or at least you can rule out bilharziosis as travel to endemic area, but bilharziosis it will not appear in such young age. It would take time. The HIV questions any casual relationships, and when you ask here, do you have any casual relationships? You have to ask, is it protected or no? Don't assume that she has unprotected sex, and you will tell her it's related to your casual relationship. You have to confirm, is it protected or no? Okay.
Okay.
Do you smoke? Do you drink alcohol? Alcohol here is very important. Even small amount of alcohol or binge drink, you have to address. It might be related to the case. And you can put as a differential alcoholic liver disease, particularly in Europe. The non-alcoholic, it's not common in this age. The autoimmune might be in this age, as Dr. Mayada said, but again, the case will be Wilson. Of course, the job here you can ask with the impact on the job and daily activity. The last
Yes.
examination of liver disease is known, like GI, any GI or gastric or abdominal station. So don't forget all chronic liver disease stigmata. Started from the tremors, either fine or flapping, mostly flapping tremors. Leukonekia, koilonychia in the hands. Don't forget Dupuytren contracture in the hand as well. And proximopathy, blood pressure, glucometer, or finger break marks. Then the face, of course, you will have jaundice here. You can offer slit lamp, as Dr. Mayada mentioned, asking for Fisher-Kaiser ring, and the mouth for any jaundice, sorry, for any ulcers or any. What do you suspect this patient might have anemic or pallor? Do you think he might be anemic or is having pallor?
Anemia
Any
or pallor?
suspicions? Yeah.
Yes. It will be
What
difficult to
could
be
be
seen
the
because of the
cause?
jaundice, I think. Yes.
Okay, if I told you he has pale palms, what do you think the cause of this? Of anemia, I mean, and pallor.
Pain cause of
Okay,
anemia in this patient.
yes, exactly. Let's make it in another way. What's the cause of anemia in such patient?
Maybe it's anemia. Yes, yeah. Anemia maybe has hemolysis if he took any medication.
The common, give me the common cause. Chronic liver disease will present with anemia. Why and how? It's very
Okay.
common complication.
Decrease nutrition. Decrease nutrition. Okay.
Okay, maybe.
Chronic
Okay,
liver disease also maybe. Yeah. Maybe has if there is portal hypertension, maybe has esophageal varices or bleeding.
yes, this is the one I'm searching for. So portal hypertension with complicated with cerebral varices. This is the most important complication. By the way, you have to do variceal scopy as a survey. They might have
Yeah.
it, and with the time it might bleed. So they might do
Yeah.
prophylactic ligation. So you have to
Also that may yes.
expect as a complication and to screen for them. So
Okay.
esophageal varices is one of the possible cause of anemia. What other possible cause of anemia in such patient?
Also maybe because of the chronic liver disease, he has decreased prostomal concentration and the time. He has liability of bleeding. May will find him he has bleeding from
So still as a bleeding.
but yes.
Okay. What
Uh,
other cause of anemia?
will be decreased appetite also.
Okay, vitamin deficiency. Okay.
Okay.
Alcohol also anemia of chronic disease or macrocytic anemia with alcohol.
Okay.
Another
Okay.
association with hepatitis or autoimmune. What do you suspect if this patient is autoimmune hepatitis?
Autoimmune hepatitis. They also have sometimes association with malabsorption, I think also.
Okay, malabsorption. In the form of what? Pernicious anemia, do you think it might be associated with autoimmune hepatitis? As an autoimmune, okay. So we'll move from the mouth as an anemia and we'll go to the neck, raise GFP, and the neck and chest, front and back. You have to examine for what? Front and back.
Uh, Back for anemic heart failure, if there is fine
Okay,
creptation.
by inspection.
Uh, by an inspection of the back, you mean?
Yes.
We'll see if there is spider nevi, I think.
Perfect. Yeah, this is the one. Spider nevi either in the front or the back.
Yes.
Okay. Okay, at the front, what other examination?
Examination of the front of the we'll see the heart
Before
auscultation.
the heart, inspection. Always start by inspection.
In inspection also we'll see the spider nevi, the loss of axillary hair.
Exactly. Axillary. And in the front, the chest.
In the front of the chest.
Gynecomastia.
Gynecomastia, yes.
Okay. Then
Yes.
the abdomen, mostly you'll find most of the finding in the abdomen. So you can skip the chest now. Why? Because you might have hepatosplenomegaly or hepatic, or sorry, cirrhotic liver or splenomegaly, caput medusa, ascites. So you
Yes.
can, yeah, you can find a lot of things in the abdominal examination. Axillary lymph node, don't forget to examine,
Yes.
and lower limb for edema, and that's it. Differential, I think here, Dr. Mayada, we can put in the top Wilson, of course, due to family history. Then we will put the alcoholic liver disease. And the last is the infectious causes or infectious hepatitis. Isn't? Or you have another differential? Please, Dr. Mayada.
Sorry, say it again.
Yeah, the differential. Wilson disease.
Yeah, it will be
Uh,
the acute hepatitis, all the acute hepatitis, like Wilson
acute,
disease,
yeah,
acute
hepatitis A, for example,
viral,
maybe.
viral hepatitis,
Okay.
parasitic hepatitis can be cause any infectious, and then autoimmune. It's still alcoholic because alcoholic liver disease is
Yeah,
broad, so it's
yeah.
still alcoholic liver disease.
Okay.
It can be a differential in this case. We cannot exclude anemias as well. Because this patient also may have chronic anemia. Sorry, but he
Hemolytic
asked about
anemia.
hemolytic anemias. It
Okay.
still can be differential here. And most, I think this is a most. In this
Yes,
case.
perfect. Okay. So I think we will open the discussion now after knowing the case. Dr. Ahmed, can you write the case scenario for Dr.
Yes,
Mayada?
I can write as a case, yes.
Yes, please. Any question from others, please, or any comments? Any suggestion? Any added points?
I put the case.
Okay, 33 years old male with the painful joints, hemoglobin 12.8, white blood cells 14.8, eosinophils 9.3, normal less 9.35, platelet 306, liver function, creatinine normal, ESR 68, patient name Mr. Jack. Get ready, Dr. Mayada. I will read the comment in a few minutes.
Sorry, where is the case?
In the chat box, Mr. Jack, 35 years, 33 years, male with painful joints, the hemoglobin 12.8, WBCs or white blood cells 14.8, eosinophils 9.3, normally less than 0.35, platelet 316, liver function test creatinine are normal, ESR 68. The comments will start from, yes, anyone guess the case earlier before Dr. Ahmed know the case? I think Dr. iPhone wrote Wilson, yes. Dr. Sarah also Wilson, perfect. Dr. Hatem Wills, Parkinson, liver plus CNS, it is Wilson, yes, perfect. Plus young age and family history. The iPhone also wrote eye examination, perfect. Slit lamp particularly you have to offer. However, it's not there and they are not experts on doing it. They have some eye drops to put to look for the appearance of the iris. Yes, slit lamp, it's eye examination. History of trouble, yes, for bilharziasis. Yes, again, don't mention bilharzia in differential unless you have travel history to endemic area. Otherwise, it's not correct differential at all. So don't put it in Europe, but you can put it in Egypt as a differential. Flapping tremors particularly, yes. Acute viral autoimmune, Dr. Hatib, differential, yes, I agreed. Acute viral autoimmune alcoholic plus our case, Wilson disease. Explore about dark urine, pale stool, itching for jaundice. Perfect, Dr. Sarah. So the skin either to be as jaundiced or yellowish with pigmentation, or it would be with this scratch mark for itching. Itching may marks also, yes, thank you, Dr. Aisha, this is what I mentioned. Maybe pale, yes, I agree. If there is anemia, again, gastropathy for feeling sick, all this complication of portal hypertension, pernicious anemia as differential or causes of anemia in hepatic or chronic liver disease, particularly the autoimmune one. But Kayari, perfect, Dr. Hamid, Abu Hamid. I was about to mention it, but I remember the ascites. So you have to have 3 of the symptoms: the abdominal pain, severe abdominal pain, and jaundice and ascites. If we have ascites here, definitely we can put it, but I don't think it was positive. I don't know, Dr. Mayada mentioned ascites or no. But yes, it's valid if you have ascites plus abdominal pain, which is severe, and acute onset, of course, we have the same. So still, you can put it, but as acute, you I agree. Dr. Mayada, if you're ready, we can start. Let me know.
Yes, we can start.
Yes, Dr. Sarah, I agree for acute presentation, yeah, within 6 days, but I guess bad care will be more acute, maybe 2 days or hours, because of the pain severity. Patient will not tolerate the pain.
The next one will not do it.
Okay, Dr. Mayada, here you go.
Hi, hello.
Hello.
Hi. I'm talking to Mr. Jack, 63 years old.
Yes, I'm Mr. Jack. I'm 33 years old.
33, okay. Sorry. Hi, Mr. Jack. Can you tell me what's brought you to the hospital today?
I feel I have my ankles, wrists, and elbows. There is pain from last 2 weeks.
Okay. So you have pain in your ankle and, sorry?
Wrist and elbows.
Okay. For the last 3 weeks.
2 weeks. Yes.
For the last, sorry. For the last 2 weeks. I'm sorry for hearing that. Can you tell me this pain, since it starts, how can you grade your pain from 0 to 10, as 0 is no pain and 10 is the maximum pain you ever had?
It is 4 over 10.
4 over 10. Do you have any swelling in these joints?
No, I have not noticed any swelling.
No swelling. Okay. Is it happens suddenly or is it started gradually over this period of time?
Because it has started. Actually, I don't remember, but it started suddenly because this first time to see this pain like this.
Okay. If you will describe this pain, how you can describe it? It is sharp, dull,
It is dull.
dull pain. Okay. Is it go somewhere else apart from the joints?
I only feel in my joints, doctor.
Okay. Is it worse by movement or by rest?
I have not noticed that movement increasing or it is present all of the time.
Even if you have rest, anything change?
No, it is present on the rest and the movement.
Okay. Do you have any morning stiffness? I mean, like you feel like stiff in the morning.
Yes, I have.
Okay. For how long?
That one also started since the 2 weeks.
No, I mean the stiffness before you can get rid of it. For how long you feel this is stiff?
When I feel the pain, I feel the stiffness, all present with each other. I have not separated them.
Okay. So when let's say it again, if you get up from sleep, you feel yourself is stiff. How long you need to get you to your normal, or you are feeling stiff all the day?
All the day.
All the day.
All the
Okay.
pain.
If the pain come at night,
I have not noticed any change either night or morning. It's the same.
okay. So do you feel any clicking sound or locking on these joints?
No, I don't feel clean.
Okay. If there is any redness or it feel warm to touch?
No, I can't touch them even there is pain. I can't tolerate the pain.
Okay. So when you touch them, if there is any pain?
When I touch them, there is pain, but I can't tolerate this pain.
Okay. It's okay. Do you have any difficulty in walking or dressing or using these joints?
Yes, because of this pain. I feel difficulty because of the pain.
Okay. Any limitation of the motion?
Limitation of movement, you mean?
Yeah.
I don't have limitation of movement. Just when I walk or I feel the pain present. So that one is the most of the stressing me, and that one that making it difficult. But it is present all the time.
Okay. Do you have any high temperature?
No.
Do you feel fatigue?
Sometimes I feel fatigue
Over this period or before that?
over this period.
Okay. Is it new for you?
Yes, I first time to notice this. It has not occurred before with me.
Okay. Any weight loss? Any weight changes?
No, there is no weight changes.
Okay. Do you have any skin rashes?
Skin rash?
Yeah.
No, I don't have any skin changes.
Okay. Do you have any mouth ulcers? I mean
No, I
mouth,
don't.
yeah.
No, I don't have.
Okay. Or in your private area?
No,
Okay. Do you have any redness in your eyes or any pain in your eyes at all?
no, I don't have.
Okay. Do you have any change in your bowel?
Change in bowel? You mean motion increase?
Yeah.
No, no, I don't have.
Like loose motions or you don't
No,
have?
no, no,
Okay. Do you have any frequency in your water work? I mean, increasing the frequency
no,
or any change in your water work?
no.
Okay. Apart from these symptoms you had, do you have anything you should be aware of or something
Uh,
concerning you?
you mean in this last
Yeah,
two
over
weeks?
this past period, yeah.
No, doctor, but I feel that I have also lost weight also.
You lost weight.
Yes.
Okay. Do you been diagnosed by any illness I should be aware of?
No, apart of from I have diabetes and I'm taking insulin
Okay. When you was diagnosed with diabetes?
since 2 years.
Since 2 years. Okay. And do you ever observe that you have change in your eye color?
Eye color? No. I have not a change in eye color.
Or your skin, anyone mentioned that you look like more yellowish or pale?
No.
You never have any skin rashes at all?
No, I don't have.
Okay. Do
I-
you have any trauma to these joints?
No
Any
history of
injury?
trauma. No.
Do you have joint problem previously?
No, I don't have.
Okay. Do you have any family history of like rheumatoid arthritis or psoriasis?
No, I don't have.
Okay. Do you take any medications?
Sometimes I take some analgesics because of this pain, and also I take insulin, as I told
Okay.
you.
Okay. Apart from that, do you have any drug medication list?
No, only this analgesic brufen that I'm taking,
Okay.
insulin.
Okay.
Sometimes cough syrup.
Okay. So this is on and off.
Yes.
Okay. I will ask you some question. You just need to reply by yes or no if it's present. Do you have any headaches?
The headache is the normal doctor. Yeah. Sometimes I have headache going, and but it is not all the time. Also,
Okay. Uh, do you have any weakness?
no.
Do you have any change in your vision? Any visual disturbances?
No. You asked me before.
Oh, sorry.
I don't have.
Okay. Do you have any pins and needle sensations in your body?
No.
Okay. Do you have any short of breath?
No, I don't have.
Do you feel your heart racing?
No.
Do you have any cough?
Sometimes.
Okay. Sometime, do you mean this is something new now during these 2 days, or
No,
can it?
maybe because of the weather changes, doctor.
Okay. Do you have running nose?
No, now I don't have runny nose.
Okay. You
Well,
think
last month I have. Yes.
because of if there is any phlegm with this cough?
No.
Okay. You told me that you have no loose motion. Do you have any tummy pains?
Tummy pain?
Mm,
No, doctor, I don't have.
mm. Okay. And do you have any? Do you thrown up or like feeling to thrown up?
No,
Any difficulty swallowing?
no, I don't have.
Okay. I will ask you some private question. Is that okay?
Okay.
Are you married?
Yes.
Any change in the relationship? Any change with the sexual relationship with your partner?
What do you mean by change of sexual with my partner, doctor?
Your desire?
No,
You think there is no change?
no change.
Okay. Then you told me before that you have no change in your water work as well.
Yes.
Okay. Now I want to examine you.
Okay. What do you want to tell them?
Okay. I will start with the general look for the patient. I will examine to his eyes for color and jaundice, and then I will jump to examination for the joint. I want him to show me the joint.
Okay.
Okay, which joint is affected?
The joint, as I told you, the ankle, wrist, elbows.
Okay, I will look for swelling there is no swelling, and I will look for is it warm or not, and then I will do active move at the range of movement. I ask the patient to move the joint as active movement. If there is anything, any limitation,
Okay.
then I will do passive movement, and then I will see if there is any restriction. I will look for symmetry and asymmetry of these joints, if there is anything positive.
Nothing positive.
Okay, then I will complete my examination by examining the chest for any sign of heart failure and cardiomyopathy, and if there is anything.
No, all normal.
I will examine the tummy for hepatomegaly or splenomegaly.
No,
Look for any ascites.
no,
Okay, and then if there is any problem with your back, any back problem.
2 minutes left.
no. I don't have back problem.
Okay, and any change in skin color? You said no previously, huh?
No, no.
Okay, and okay, what is your concern?
What do I have, doctor?
Okay, so from the history at the moment, still there is many differential in my mind. There is a lot of thing around the corner, but we need to run some blood tests and investigation. Given your history of this high blood sugar and diabetes and this joint pain, we need to investigate more further for a disease called hemochromatosis. Do you ever heard about it?
No, doctor. Tell me.
Okay, this one of the differential where the disease there is a high iron concentration. It can cause your symptoms. However, still we need to investigate more because there is another possibilities as well. Is that okay?
Okay.
Okay. How these symptoms affecting your work? What do you do for a living?
But actually, because I am working as a secretary and I use my hand for writing on the computer, it has affected me.
Okay, I will refer you to the occupational worker in your job. They can help you on that issue as well. But first, we need to find out the diagnosis. If that sounds okay.
Okay.
What about alcohol? Do you drink alcohol?
Social.
And smoking?
Yes, sometimes I smoke 3 or 4 cigarettes per day, no more.
Okay. If you can stop all smoking, generally, it can help your health. And I can help you with the smoking cessation clinic. Does that sound good?
Okay.
Okay.
Okay. Time's up. You want to ask any question else?
Okay.
Any
Yeah.
specific particular question?
Yes. What is your differential diagnosis here?
No, Dr. Meda, I want
Yeah.
to do any
Yes,
question
Dr. Meda.
or to do any examination step before going to the examination examiner question.
For the examiner question, okay. I think I asked most of the.
Okay, if
As
you're
far as I
satisfied, you
know.
can, yeah, no problem. So we can go to the examiner question. And please, Dr. Ahmed.
Yes. What is your case? Can you present your finding?
Okay, so this 33 years old gentleman has a history of 2 weeks joint pains and he has background of diabetes. He also have a weight loss and this is a positive finding is him on him. My differential diagnosis ranging from hemochromatosis, giving his background of diabetes and his joint pain, and again, it's that there is no sign of hepatomegaly and there is no sign of cardiomyopathy. It's also, maybe this is a joint pain secondary to autoimmune like rheumatoid arthritis. However, there is no history of rheumatoid arthritis in the family, and but still it can be one of the differential diagnosis. I was thinking about psoriatic arthritis as well. Again, is that there is no skin rash, but still we can think about it. But he has no back pain or symptoms indicative of psoriatic arthritis. This is what I'm about.
Okay, excellent. So you think this is hemochromatosis?
Yeah, one of the possibilities here.
Okay. What else in the, if I extended time, you wanted to examine this patient?
For hemochromatosis, I will examine the abdomen, looking for hepatomegaly. I will examine the skin, looking for skin rashes. It will be bronzy color if it is the case. And I will examine the heart for the cardiomyopathy. I think I did that.
Okay. Okay. So this patient has increased of eosinophils. So what is your differential of this eosinophilia?
Eosinophil count
Yes.
with joint pain.
Yes. The differential of eosinophilia.
Not in my mind, in fact.
Okay. Okay. Much. So
Like psoriatic arthritis can come with this, and I think there is HES. This one I didn't remember, but hypereosinophilic syndrome. The name I think this is the name. It's
okay.
like this.
Okay. So the main differential for you is hemochromatosis because of the joint pain and the diabetes. This is the main differential for you.
Sorry.
The main differential for you is the hemochromatosis.
Yeah.
Yes. Okay. So no other causes of this eosinophilia other than hypereosinophilic syndrome, you thought?
The other autoimmune disease can come with eosinophilia as well. The rheumatoid arthritis and the arthritis SLE, all this can come also with the same things. And also from the differential, it can be drug reaction. But again, it's that the only medication he's taking is, but he's taking some medication. I think drug reaction still can be one of the differential diagnoses.
Okay. Excellent. Excellent.
Yeah, it's still.
Okay. 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 So can I commit to Dr. Bassem?
Did she mention the investigation and management plan?
Yes. What is the investigation and the management?
Okay. So the initial investigation, I will do full blood count, CBC, and differential. ESR already we have on CRP. I will investigate more for ANA and rheumatoid factor and ANC, ANCA. Also, I may need to do chest X-ray and CT scan to see if there is any lung involvement, if I am thinking about rheumatoid arthritis and the things. This is the most investigation I will do. For hemochromatosis, I will do iron study to confirm the diagnosis or roll out the diagnosis.
Okay.
Okay, time is up, Dr. Ahmed. If you want to comment now, you can comment.
Okay.
Because
Actually,
I think she didn't. I don't know if she catch the case. That's why the question is not target.
okay. Actually, the case is difficult. Okay. But you have the clue here is eosinophilia. So the most important you will ask regarding the differential diagnosis of eosinophilia. Okay. So she did well. As a whole, she did well because this case is difficult. She can ask regarding the travel history because helminths also can cause this eosinophilia. The drug allergy also, if there is any allergy of any medication, okay. She can ask if she has this any allergy like pollen allergy, dust allergy. Maybe this patient has any allergy. Maybe she has not shortness of breath, but I told like I have sometimes cough or like that one. Okay. Other the malignancy like lymphoma and leukemia, it can cause also eosinophilia. Okay, so important to ask regarding the travel history. She missed all the travel history, but she did well in the rest of the history. She first asked regarding the joint as it is rheumatology case. It's okay. And then she did well in the examination. Even she has not reached the case. This case, it will be vasculitis because nothing else will be in the history. No helminths, no travel history, no drug allergy. On examination, there is no lymphoma or leukemia. Even the blood CBC, there is no leukemia. You can exclude by leukemia by the CBC, lymphoma by examination. If she examined for the lymph nodes, important to be examined in this patient. Okay. In the examination, they will see the vital signs and the general examination. The abdomen for enlarged liver and the spleen for this lymphoma or leukemia. Also to see the heart also because in the eosinophils can be also deposited in the heart, can lead to a heart affection. She did well in the investigation because she asked regarding the ANCA. Okay. Even this ANCA, if it is negative, it will not exclude the vasculitis. Also, the positive result of ANCA, it will not confirm, but we should also request. Okay. Chest X-ray important, and also echo heart. Other further investigations also to be requested in this patient, also hepatitis, and also if there is any urine abnormality to ask for renal biopsy because we'll see the position of the eosinophils. Also, there is some mutations for this eosinophilic leukemia. CT scan also important, thorax, abdomen, and the pelvis, lymph nodes. Bone marrow biopsy if there is any suspected lymphoma or leukemia, but it can be excluded by the CBC. Okay. It will be mostly vasculitis after exclusion of other causes of eosinophilia. Vasculitis will tell the patient it means inflammation of the blood vessels, which can cause joint pain. It can also be associated with other forms, maybe associated with asthma. In this patient, there is no association. So we refer here regarding the further investigations and treatment. And also we'll see that this patient may be treated by form of corticosteroids. Sometimes they are giving this monoclonal antibody rituximab anti-CD20, and they are giving for this eosinophilia treatment called tromexazole prophylaxis against pneumocystitis. And also rheumatology will follow here in the clinic, and you will see the follow-up of the prednisolone. Okay, it is actually a difficult case, and I put today in order because the common cases, I think most of us will study. Maybe he has some rare cases like that one.
Okay, thank you, Dr. Ahmed. But is it exam case or just from book?
No, this exam case, yes. No, I have not found an examination, but I found in basis box present.
I
as a
didn't
case.
hear about it in the recalls actually because
Yes,
it's a vague case. Even skin rash here supposed to be having either livido reticularis, for example, or any
yeah,
type of skin rash, any type of skin rash.
yeah.
But
Sometimes they are putting this bronchial asthma and they make it Sharp-Strauss syndrome.
yeah, okay, I agree with
Yeah,
this.
yes,
Xenophilic granulomatosis with polyangiitis, I
yes,
agree.
yes,
Chargus formally named,
yes. It will do the same things and they will make the differential of
plus asthma.
hypereosinophilia because it will come in the if they bring in the examinations they will bring a high eosinophils count
Yeah,
and we
this
should
is the
search
case
for the
of
differential.
exam.
Yes,
Exactly.
yes,
This is a classic case of exam. So you will have asthma features, or difficulty of breathing or coughing or noisy breathing, plus some skin rash or some vasculitis manifestation like affection to the kidneys, but it's not common in the eosinophilic. But it's still one of the possibility to have vasculitis, skin rash as well as I said. So it would be like this, but as eosinophilic without pathology, it's difficult to be present in the exam. However, don't forget also allergic bronchopulmonary aspergillosis. It's one of the
yes,
causes of eosinophilia.
yes,
And I wrote also the bilharziasis, as you said, helminths infection. It's one of the causes. Plus Chargus. These are the cases of eosinophilia. Anyone has any suggestion for the other causes? Yeah, I wrote also interstitial nephritis. So the patient will present with acute kidney injury, high creatinine, decreased urine output, and after upper respiratory tract infection, he receive antibiotics. Then he will have this manifestation. You might have also acute kidney injury along with eosinophilia. So these are the possible cause of eosinophilia in the exam. Plus, what you mentioned, vasculitis with lymphoma or leukemia, whatever. Apart from that, the comment on Dr. Mayada, I think Dr. Mayada also was lost because of the difficulty of the case. But still, I need from you, Dr. Mayada, to be more organized. Again, the most easy approach to do, what I prefer, and you can catch any case. Starting analysis of the complaint. Of course, after detection, some doctors wrote that you didn't introduce yourself, but I'm not sure. The agenda of the scenario, yes, I'm here to do one, two, three. Uh, I heard from your GP that you have one, two, three. Then the analysis of the complaint, whatever the complaint here, you will have the pain. You analyze the pain well, but the radiation you have to ask, does it go anywhere? This pain plus the severity you mentioned already. If you have more than five, you can offer painkiller instantly. Then the previous attack, as you said, or as you asked, any previous attack of the same condition. Then the constitutional symptoms, or here the musculoskeletal, you have to ask about relevant system. The relevant system here, musculoskeletal. So you will ask about any skin rash or any back pain or any stiffness. I prefer to ask this question. So musculoskeletal, joint or muscle, you can add to them the skin plus the back and bone. If nothing, you can go to the constitutional to rule out any serious infection or connective tissue disease in this scenario. If no, the past medical history here is very important. If he mentioned to you, for example, I have diabetes, I am having some medication for immunity, you can suspect, or I have asthma, I have inhaler, you can suspect any underlying cause of eosinophilia from what we mentioned already. Then the surgical history, allergical history is very important here. If he is having allergy, you can suspect asthma itself as a topic or allergic reaction. The patient might have this, or ABBA, as I said. Then you can do the systemic review from head till the toe in quick manner, as we know, and focus on the chest because most of the eosinophilic disease comes in the chest, as we mentioned here, eosinophilic granulomatosis polyangiitis in the chest, allergic bronchopulmonary aspergillosis in the chest. The next system is the genitourinary, eosinophilic or interstitial nephritis. Then the vasculitis, as vasculitis, it can affect many systems. So you can ask about even the nerves. Mononeuritis multiplex, it can be associated with vasculitis. You can ask about any pins and needles or weakness. It might be associated. Then already they ask for the GI, the genitourinary, and the past medical history. Sorry, the family history, travel history. HIV here also important to know. Do you smoke? Do you drink alcohol? And the job. You can ask them before the examination because once you forget, maybe you will not ask, and it might be the case. The examination here, as the case is vague, you can do everything. You can examine for the palm as a systemic approach. So the palm, the hand, the pulse, the vital sign, the face, pallor, jaundice. No specific system you can examine unless you have particular affection in the systemic review. For example, if you ask about any noisy breathing, so you will ask to examine the chest, complete examination of the chest. Start by inspection, palpation, percussion, auscultation. If no, you can just inspect the chest or offer examination of the chest. In this scenario, I don't think there is any positive data. However, skin rash, livido
He said
reticularis,
that she has
I believe.
cough syrup, taking cough syrup, so
Ah,
he has
yes.
cough. Yes.
Yeah, perfect. I think yes, yes. So the cough here, I don't know, Dr. Ahmed, you can tell us about the cough because Dr. Mayada also forgot to ask about cough, I think. Is it
Yes,
related to asthma or?
because allergy also can cause this. Yeah, I bought many things. It can be this
Okay.
atopy because of exposure to dust and pollens.
Mm-hmm.
So I thought that there's sometimes cough going.
Yeah. So it might be. Also, asthma here, it would be very important. There is IgA mediated asthma, I think. So you can put it as a differential, particularly. Eosinophilic pneumonia, also particularly, you can suspect. These are the common cause and the common differential. As we see, it's related to the chest. Most of them related to the chest, and one related to the vasculitis, skin or autoimmune, and one related to the kidney interstitial nephritis. Otherwise, Dr. Mayada did great. It's difficult to say this is hemochromatosis. I don't think the hemochromatosis will be associated with xenophilia. However, again, it's difficult scenario. Even most of the doctor didn't know the diagnosis.
She thought because of the joint pain and
Yes,
diabetes.
diabetes.
Yeah,
Yes,
yes, the case is difficult, but also she's thinking well, really. Also,
yeah.
The
It's
weight loss
thinking.
really can lead us to the diagnosis because the weight loss, if you will analysis it is with good appetite or poor. If it is poor appetite, we have only four in our mind. If we exclude, we will reach that it is a vasculitis. Because weight loss with poor appetite, it is even if not
Yes,
Addison, it is even cancer or
connective
chronic
tissue.
infection or vasculitis. It's only three.
Perfect. Yeah.
So I think because that I in my mind when he has weight loss, I found in myself it is definitely towards the vasculitis.
Vasculitis.
Yes, even if she said vasculitis, I think it will be right because already it is on the group. But here, I think Dr. Mayeda also you take a lot of time in analysis of joint pain. I think in exam, if you taking 3 minutes, I think, and it is very long time. You can make it like more than fast with yourself, like to be short question or just spot yes or no to be very more rapid because the joint pain, if coming exam, it is usually long case, a lot of question you should ask all the rheumatology. But it's really, yes, it is difficult when Dr. Mayada did her best in it. Just if the weight loss in one case for all of us, we
Yeah,
can manage our mind. It is only 3 and addition. So you can exclude in history rapidly, so you can reach early.
yeah, I agree with you, Dr. Aisha. Plus, if they bring such case in exam, they bring it with the skin rash, or vasculitis skin rash, or livedo reticularis, or Raynaud's. Something or some clues will guide you to the vasculitis, not only as eosinophil. So I agree with you. Loss of weight plus skin rash plus some pain, joint affection, maybe nerve also, neuritis multiplex. It can guide you to the case. Any other question or comment, suggestion?
Appreciated really, Dr. Bassam. Okay.
Most welcome, Dr. Ahmed. There is also possibility of polyangiitis.
Yes.
If you have abdominal pain, testicular pain, you can, but it would be also as vasculitis without eosinophilia, or it might be associated with eosinophilia. But again, it's not classical case of exam.
Yes, also here the food and the bits will be important here. If she
Yes.
eating like
Allergy.
pork, yes, and because like this is hydrated, I don't know the name of this diseases, but it is by animal. It is called eosinophilia, and if she has pets or he has pets at home like that, can also be question to exclude the cause of eosinophilia.
Mhm. Okay, perfect. Again, it's not a common scenario in basis exam, but be ready for any scenario. And again, they can guide you to the case, and they can judge you on the performance and the approach. If the case is difficult, they will not ask for the diagnosis. They can put you under the performance judgment, and they can judge on the approach plus the differential. If you give the case differential as the second diagnosis in the differential, you might get the full mark, particularly such difficult scenarios. But let's hope the scenarios will be clear and it would be more repeated topics and scenarios. Any suggestion
We
for?
hope.
Yeah, hopefully. By the way, it would be like this. If you follow the approach well, you will know the case from maybe third or fourth minute. The problem is to know what's the associated symptoms or associated, for example, differential. What I mean, if you have, for example, patient with chronic liver disease, as in this, you will know this is a chronic liver disease patient. But what the underlying pathology? You have to know. And you have to rule out the others. So, as the previous case Dr. Mayada brought, it would be Wilson disease. But you have to rule out alcoholic. You have to rule out the hepatitis. You have to rule out autoimmune. You have to rule out, for example, bad Chiari. And you will put the differential as you started to roll out and to tell him, I didn't find the things might give me the differential of, for example, acute hepatitis. There was no travel history, so it's not hepatitis A. There was no alcoholic history, or there is history, but it's not adequate to say this is alcoholic, but still one of the differential is alcoholic hepatitis. This is the way how to think and how to play the game of communication in the exam related to this long clinical consultation. How to play with the surrogate. He will give you clues. It's like puzzle game. You will collect and you will arrange, and at the end you will give the examiner what the photo you collected. And while doing this steps, you have to examine every system affected. For example, in the previous scenario, you will examine the liver itself, chronic liver disease, stigmata, the jaundice itself in the eye. If you suspect something else like alcoholic, you have to examine for dipterin, you have to examine for parotid, and so on. This is the way how to get the full mark. It's not an easy, and it's not that much difficult as well. Okay, clear for all?
Oh, yes.
Any question or comment or added suggestion? Dr. iPhone, I believe this case should be for hematology subspecialty, not for basis. I agree. And as I said, it's not common scenario. The common scenario really related to eosinophilia is eosinophilic granulomatosis with polyangiitis. It comes. So you will have patient with asthma features along with vasculitis, along with nerve affection, and they might tell you eosinophilia or not. But you might have the asthma features which is resistant to treatment. You will suspect this is asthma, but the patient will tell you, no, doctor, I am not controlled well. I am not, although I am compliant to the medication, the inhaler, I notice the asthma is not improving. Along with worsening of other system like nerve affection, peripheral neuropathy, or maybe kidney or any other system affection. So it wouldn't be single organ,
It's
but it
really
comes in the exam.
nice.
Easy.
Case very. I like it. Very nice case because it's open your eyes.
Yes, of course. Yes.
You
Yeah.
think more. Yeah.
By the way, if you solve a difficult scenario, everything will be easy.
Mm.
But not solving it as a clear diagnosis. You are not here to give me a clear diagnosis. Still, you will do some lab investigation, work up, just X-rays or imaging, but at least give me a differential that include the most appropriate diagnosis. That's why I'm saying it's a puzzle game. You collect and give the last image or photo for the examiner after doing the examination. According to the photo you collected, he will give you the mark. If it is scattered one, he will minus you. If it is a regular one, organized way, you will get or you will gain good marks. Enjoy the game, and hopefully you will have the
And I
success
think
soon.
in exam they like to bring cases with finding in examination because this is 4 marks.
That's why I
So
said,
they bring a case with a lot of finding to deduct you. So they playing odds
yeah,
like
that's
that.
why I said any system
In my
affected.
2 cases in exam, it is a lot of finding. Really, you have no time because you have a lot of examination you should do.
That's why you have to finish the history as soon as, Dr. Aish.
Yes, and also when I hear the cases come in exam, they bring cases with a lot of finding. He should bring like finding, not like the Irish exam. He may bring also just normal person, but in basis they
Yeah,
bring a
yeah,
lot of finding.
yes, exactly. You're right. By the way, that's why the UK exam is very difficult. As you say, Irish, maybe they will have the surrogate. Already he is not having any symptoms or signs. So the examination step will be fast. But in the UK, they have clear patient with clear finding, and you have to pick up most of the finding to get
And one
the
of them
full
is
mark.
acute already. Acute case.
Yeah, they can bring one acute and another as a chronic. But believe me, if you trained and practice
In their side,
multiple times,
the most sessions that deduct the people or making the people fail, it is the finding. So they making it more difficult. They don't want anyone to pass.
no, no, believe me, if you do,
Finding maybe more and more.
maybe you have to see more patients. But
The problem, I think, is a problem not like that. The problem is the time. In long station, I think the problem is the time.
ان الحرب ما تعودش مره اخرى. ودينا شايفين ان الناس في حرب غزه تقول لك هنمول الاعمار ثم ماذا بعد؟ ما في امكانيه لعوده الحرب. فانا اظن ان اذا اتخذ الجيش منهج العمليه السياسيه والاعتراف بكل الاطراف
I think this intervention wasn't with us.
Like example, Dr. Bassem, I have heart failure in my exam, and he has CABG surgery, he has AF, he has aortic stenosis, and he has anemia
Perfect.
7, and I examine the heart and chest, and examine for what else, the heart examination all, because there is AF and aortic stenosis, so it take like 3 minutes to examine the heart only. About the heart failure, I examined for lower limb edema and for
Bibasal crackles.
bibasal crackles, and
Sacral edema.
I missed this ascites. They deduct me for ascites because no time to examine the abdomen. If I'll do abdominal examination for hepatomegaly and ascites. And even one of my colleagues examined for ascites and no ascites, but he asked
Yeah,
me
he
and
wants
he
you to
deducted. He wanted
You know,
us to
Dr.
explain
Aisha,
it. Yes.
yeah, you know, if you say
I
I
know
would
that I
like,
should examine, but really no time.
no,
I
no,
have
if you
2 minutes
didn't find
remaining.
the
I
time,
should ask the concern. Yeah.
please make it as a habit. After examining,
I tell, and also my
yeah,
college tell them that in Jordan, regrettably, they write in feedback, we didn't examine, even we said, I want to examine, I wanted to complete.
I would
I
like you
think
to,
they will
yeah.
not, they didn't mention that. For me and for other colleagues, they didn't, even if you said, I want to examine like that, and I want to complete the examination by like that, they didn't make it as you did.
It's so difficult to, but yeah, let's train on it. As I said, it's not impossible. I get 28 in
Just
both
to
scenario,
make
which is,
you that the history should be very fast for you,
that's why,
to make
yes, that's
you
why.
very fast. Yes.
Make your history concise to the target, roll and remove the question or unnecessary question, finish the history quick.
And to be fast in talking. I like the Indians that
Exactly,
they are
yes,
very fast. Question and
yes,
question, just they making like less
perfect.
than seconds to reply, and they
And you
ask the
can,
other.
yeah, don't sit thinking what I will ask now. Should I ask about do you smoke? Yeah, do you smoke? No, no time to think for a second. If you finish and you don't have time to think what to ask, go to examine the patient. Okay, after you finish and you get the clue of the case, examine the patient immediately. While examining the patient, you can address the smoking, the alcohol, the driving, and the impact, the job. Because this question, if you are asking them while sitting, it makes like it takes time. But while doing examination, already you are focusing in the examination. Even you are not focusing in the examination, you are doing the examination step. For example, you will do superficial palpation for the kid, for the liver, or deep palpation for the liver. While doing these steps, you can ask him, do you smoke, do you drink alcohol? Just act like you are examining and at the same time asking. Okay, but
And
don't
it is not the
sit for
patient
long time.
it is you will ask the surrogate. So
Yeah, I know.
while examining, you are looking for the surrogate. It will be hard.
No, he will come. He will come to you. In my
It
exam,
is
he was
he
standing.
already he is sitting beside the patient, so it is okay. But
Anywhere, you can ask
yes,
him and he
yes,
can answer you.
we can train also about that. Yes.
It's really, believe me, it's a matter of practice. Multiple practice make you shorten your time while asking the history, while examining the patient, and you can pick up most of the finding easily.
Yes, you're right.
I told you about two examples in my exam, and it was a lot of finding. By the way, it's not only one finding, and they give me the 4 marks in both scenarios. So it's not difficult. It's not impossible. It might, and you might do it. Just train how to ask quickly, fluently. Whenever I finish the history, I will jump to examine the patient. The questions which is social or travel, occupational, I can ask while examining, or even while moving to the patient, because I will move or walk for few steps, or the patient will unwear his t-shirt. I will ask him, please, can you expose your chest? During taking off his t-shirt, I will ask this question. But please finish the systemic review and the past medical history and the relevant system. Complain as soon as whenever you know the case, or at least you have the clue, examine the patient. Why? Because there is a lot of finding waiting for you to pick up and to correlate it with the diagnosis. It's a matter of practice. Believe me, whenever you practice a lot, you will have the confidence to do these steps quickly.
Yes, you're right.
Okay, thank you, Dr. Aisha. Any other question, comment? Dr. Mona Ibrahim, it's luck and somehow examiner dependent. Yes, I mentioned this in summary the day before yesterday. So the exam is the matter of luck. Either you have good cases with good examiner, you will pass. Good cases with toxic examiner, he might fail you even if you did well. Or you might have bad cases with good examiner, he might guide you and help you to pass. So it depends on your luck on that day, the case scenarios, along with the examiner
It is better for me
behavior.
to be difficult scenarios or difficult
Yeah,
case
I believe, yes.
more than to be bad
Yes,
examiner. Because if you know the
exactly.
case and they
Exactly.
reach smoothly and you found he making
Absolutely right.
many wrongs, it
So
is all the marks. So you will be like, what even I didn't know the case. How
yeah,
much you will give me like that?
exactly. So this is the matter. If you have good examiner, this is the best thing to do. My exam abdominal station was ascites, and the patient was having abdominal pain. Whenever I touch him, he has pain. I want to palpate for liver, he's ouching. Oh my god, the spleen, I cannot. I look at the examiner, I said he has pain, I cannot proceed. He looked at me and he didn't say anything. So I know there is ascites. So I asked him to put his hand, and I did the thrill. I didn't examine the liver at all because of abdominal pain, and I told him I cannot examine him because of abdominal pain. He minus me only 2 marks. So I didn't examine the liver, I didn't examine the spleen. Of course, the kidney, because I cannot palpate the kidney, and abdominal pain is there. He gave me 18 out of 20. Be honest, don't invent, and just try to be honest with him and wish he will be kind with you. And he was kind to give me this mark, really, because I didn't examine the abdomen at all. But also, this is their fault. They bring a patient, or they brought a patient with abdominal pain.
But
So
he
it's,
is
as you
kind,
said,
yes,
the best
because I
thing,
have
the
case
good
like this and he deducted me
examiner.
all the marks. Yes, it is examiner
Yes,
dependent.
you might do the all steps and you didn't.
I really did
You
all the
didn't.
steps, but
Yeah, that's why the good examiner, the best thing. Even the cases are bad.
yeah,
Why? Because even you do the all steps in the perfect way, he might see or ask for something you didn't do, and he will minus you the whole marks because you didn't do what he waited for you, what you missed in this. As you said, ascites in heart failure. Oh my God! So you will judge all my performance on ascites related to heart failure. Not all heart failure with ascites will be complicated ascites.
no ascites already in the case, but he just
Yeah, but
deducted
plus
for
no
abdominal
ascites. So why
examination.
you are judging me on this? That's this what I said. So it's related to the wish of examiner. If his wish to pass you, he will give you good mark whatever you did. If he wish to fail you, he will fail you whatever you did. I believe Dr. Muna, you're right in this sentence. Really, it's your luck, and hopefully, inshallah, you will find the good examiner even with tough cases. Thank you, Dr. Muna. Thank you, Dr. Ahmed and Dr. uh, Mayada. Any question?
Thank you very much.
Okay, Mr. I hope you are getting benefit from this advices and discussion. And anyone has the suggestion, please don't hesitate to suggest or to raise it, either here or to the group. This meeting is for you, so we need for you to learn and to gain a lot of information from this meeting. Anyone has suggestion to improve, please raise it. Even you can message me directly. Okay, seems okay now and satisfied all. Thank you, everyone. Thank you, Dr. Mayada, particularly Dr. Ahmed, Dr. Aisha, Dr.
Thank you very
Mona.
much.
And thank you, everyone. See you tomorrow, inshallah, with the communication day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
وعليكم السلام ورحمة الله.